Welcome to the Medical Manners Podcast, where I give healthcare providers simple tips for ways they can transform the way they connect with their patients and colleagues. Connecting with patients isn't some secret sauce that some of us have and others don't. They're just skills, implemented consistently over time. If you want to transform your medical practice, you're in the right place. I'm Katie Wyatt, your host. This episode is sponsored by the Connect Better audio course. This course is for healthcare providers who want to drastically improve their patient satisfaction or Press Ganey scores. Each week for 6 weeks, you will listen to a 5 to 10 minute audio training. Then throughout the week, your job is to implement the skills you're taught in every patient encounter. You'll be amazed at how much your score can improve in such a short amount of time. Go to medicalmanners.com and use the code PODCAST for 10% off the course. I am so excited to have Kamille Fox on the podcast with us today. I will start with telling you a little bit about her. Kamille Fox is first and foremost a wife and mother to 5, soon-to-be 6 children. She graduated from nursing school at Brigham Young University and currently works as a public health nurse with the maternal child population to promote healthy pregnancies and infant development. She also has experience working with home health and hospice care patients. As a member of the Church of Jesus Christ of Latter-day Saints, faith has always been an important part of both her personal and professional life. She currently lives with her family in the Philadelphia, Pennsylvania area. So Kamille, thank you for joining me today. I am excited to talk to you.
Thanks for having me.
I have kind of been following along with your journey lately, and I haven't been able to get you off of my mind, honestly, and I feel like we need to have this conversation. The thing that I can't stop thinking about is how we approach faith in healthcare. And it's often a topic that I shy away from, and I think many healthcare providers do, because I guess I always want to be respectful of what their faith is and try to walk with them in their faith. And so because I worry about maybe saying the wrong thing, I often don't say anything. I don't know if that makes sense, but it's something that I've thought of, especially since I was reading an article that was on the National Institute of Medicine that talked about how faith is one of the, what did they say it? Promoting spiritual care or attending to the spiritual needs of patients is now identified as a core domain in patient care by the World Health Organization. So I thought that you would be the perfect person to kind of give us some tips on how we can do that. It's an important thing. And I think there's a lot of us that don't know how to do it.
Yeah, I think as a culture, it's a good time to start examining that, because people in general are starting to look a lot more at health as a holistic practice, not just medications, right? There's so much more interest in medication, a lot of emphasis on exercise and nutrition, and spiritual health fits right into that.
Yeah, for sure. So this is something that we receive, I would say, zero training on. I don't know how your schooling was, other than they would say, check with your patients to see if they want to talk to the chaplain. That was the extent of how we can help patients with their spiritual needs in my schooling. And a lot of the times when patients are in the hospital or in that acute illness situation, they're turning to faith. And even if they're not a spiritual person at that time, they're turning to faith. So I thought it would be interesting to get your take. 2 things. You're a nurse, so get your take on how you've been able to do that effectively as a health caregiver.
Yeah, so right now I'm working as home health nurse, but in the maternal child space. So I visit pregnant and newly postpartum moms who are at risk. And that can be because they have a certain diagnosis, like gestational diabetes, or it can just be that the mother has no education, or it's a teenage mom, so they have a lot more needs for education. And as we're doing our intake visit with that patient, I have found it really important to address that topic of faith and religion. For one reason, because I have a lot of patients from different cultures. And so some of them have religions and faith practices that I have no concept of in my history. And so it's important for me to know, they'll have full altars set up in their homes that I'm oh, obviously this is a big priority. But also because a lot of these at-risk patients have a lot of temporal needs like food and clothing and housing. And religious organizations are usually a really great support for that. And so I ask all of my patients in our intake paperwork about what their faith practices, what is their religion, do they have a church they belong to where they can get support throughout the pregnancy and after their child is born. I think at first people get nervous to ask that question because it's not technically a health topic, but I'm already asking so many sensitive questions. Like I have to assess for domestic violence, right? I'm asking about your intimacy. I'm asking about like your bowel habits. So there's already so many sensitive questions. It
It's
also
so true.
feel that much more sensitive to bring that one in too.
That is such a good point. We're always asking about their poop and their intimacy. That is a very good point. So what does that actually look like? I guess I'm looking for like phrases or words or people, those of us who have no idea how to actually do this. What can that look like in a visit?
Yeah. So for me, the specific words, I wrote it down so I could say exactly. I just asked, is faith or spirituality an important part of your health journey? And for some patients, that's going to be no. And that's the end of the discussion.
Mm-hmm.
And then for other patients, if they say yes, then I want to know, okay, do you have a specific religion or faith that you identify with? And then are there any specific spiritual practices that you want to incorporate into your treatment? So, for example, both Muslim and Hindu patients have really specific religious ceremonies, basically, that they want to do right at the birth of the child. And they're pretty similar. They have different names, but they both involve whispering like the name of God into the infant's ear. It's the first sound the baby should hear when the baby is born.
Mm-hmm.
And then rub a sweet substance on the baby's palate, like a date or honey. And that's just part of their religion. But those aren't things that we're going to commonly do in a hospital birth. And so knowing that beforehand and making sure the patient knows how to educate their provider and whoever the nurse is that happens to be laboring with them, they've got to be empowered to do that.
Right. And I think your job is so important because you can let them know that that's okay. We can help them with those things in the hospital setting. You're right. I didn't know that. I would have no idea to do that or how to help them do it. But if they ask me to, I'd be more than happy to help them with whatever they needed to do there. And so I love that you're empowering them that they can advocate for themselves and ask for help with that.
Yeah, and that's a big part of the barrier for them because a lot of them there's a language barrier, a cultural barrier. So like knowing how to advocate against all of those other factors, that's really good for them.
Yeah. Any other experiences as a nurse that you've had with walking with patients in their faith?
I think that's kind of the extent of my current job. When I worked in hospice, it's very common for people to be bringing faith into a hospice situation, like you were talking about, where it's like an end of life care. Lots of people, even people who haven't previously been very religious, now are asking for the support of a priest or a chaplain or something. And so had lots of patients who have had a spiritual leader in the room while I'm caring for the patient, or even a patient where I just needed to put in a catheter and she was just in so much pain. And so she was just praying out loud through the whole procedure. It's a very simple procedure, but for her, it was just excruciating. And so she was praying out loud through the whole thing. And I think that we don't really determine when is an appropriate time to bring in faith. It's usually very common for providers to think of it at end of life care. But even when a patient is going in for a simple surgery, that's really scary. There's always a risk when you're going in and having a surgery. You're putting your life in the hands of someone you trust, but they're still a little bit of a stranger. So being able to have your faith supported in that moment is brilliant.
Yeah. Well, and I like how you said you don't really know when they're going to need it. I was reading that article and I think I sent you the link for it, but it was this article where they interviewed patients about what was meaningful or important to them as far as spiritual care went in the healthcare setting. And it had a bunch of quotes from patients, and I thought some of them were so interesting. One person said, I mean, if my doctor asked me, are you feeling or experiencing spiritual distress? I don't know if I would even want to hear that question. Which is true. I think if someone asked me if I was in the hospital, are you feeling spiritual distress? I'd probably be like, no. Right? But that doesn't mean that I don't want to talk about it. And then another person said, sometimes if you just let the conversation go, it will take you where you need to go. It is quite an interesting process once you start getting into the spirituality of a person. You know that person will lead you where you need to go, even though they don't know what they're doing. And so I think I love the idea of just creating this space of open communication where if the patient wants to go there, they can go there and we can support them in that. And it might be as something as putting in a catheter, but that was a big deal for that patient and they needed support in that time. So tell us now, because I'm talking to you and you are in the Ronald McDonald House, right?
Yes.
So if you don't mind telling us your story of what you are going through as a patient currently, that would be awesome.
Yeah. So I'm currently expecting my sixth baby. At her ultrasound for her anatomy scan at 19 weeks, they found some severe birth defects, and eventually she was diagnosed with spina bifida. So we started the process of looking into possible treatments and had tons of specialist appointments. And we found that there's an in-utero surgery where they actually surgically open up your uterus, expose the infant's back, and they close that sac, the nerve sac that's bulging on the baby's back, and then put the baby back in your uterus, close you back up, and then she continues to heal in utero for the rest of the pregnancy. And the reason that they do that is because the damage is progressive. So, like, the longer the pregnancy goes without the surgery, then the nerves get worse and worse, and the outcomes for the baby long term are worse. So, we are at CHOP, which is in Philadelphia, the Children's Hospital of Philadelphia, where they do this surgery, and had that done about 3 weeks ago. And I'm on bed rest now for the rest of the pregnancy recovering.
Wow. How far along were you when they did that surgery?
So I was about 25 and 3 days pregnant.
Okay. And now you're 28 weeks pregnant. And how is baby doing since surgery? I haven't heard that part of it.
Yeah, so I've had 5 ultrasounds. They're checking on her quite frequently. She's doing really well. So one of the side effects, or like birth defects from spina bifida, is that the baby's brain gets pulled back down outside their skull. So this is called hindbrain herniation. And the reason it's such a problem is because you've got the cerebellum at the back of your brain, and that's a structure of your brain that takes care of the involuntary practices that your body needs, like your heart rate and your breathing. And so if that brain structure is in the wrong place, then that can be life-threatening for the baby when they're born. So they close this sac on the baby's back that allows the cerebrospinal fluid to stop leaking, and the brain moves back up inside the skull where it's supposed to be, and the cerebellum kind of rounds back out. So that's the biggest thing they're looking for in my ultrasounds. And so far, it is moving back into place. The past 2 times we've checked on it, she's making progress with that. So that's exciting.
So awesome. And how long do they hope to keep her in you before they deliver? What does that look like?
So, like, gold standard, they say, is to make it to 37 weeks before you have a cesarean delivery. Their average is around 34 to 35. It's very common for your water to break or for the membranes to start separating away from the wall of the uterus, just as side effects from the surgery.
Yeah. So you've got a little bit longer of bed rest
So,
to go.
goal is 8 more weeks, and we'll see how far we make it.
That's awesome. So going back to this topic of faith, because I know that's an important part of your personal life. How have healthcare providers walked that faith path with you as you and your family have gone through all this?
With this experience, one thing that they did do is I had to have so many tests. And during the MRI, they offered to play music for me. So I asked them to play Hey Love, it's a Christian radio station. And they did that for me. And then they did it again during the surgery, which was super helpful because I was very anxious going into that operating room for such an intense surgery. So that is one way that was really easy for them to incorporate faith, just letting me have, hymns and songs about Christ playing to help me cope with the stress of the situation. Another thing that was really spiritual for us during this experience was there's a whole laundry list of qualifications you have to meet to be able to have the surgery. And so a huge battery of testing. And once we had passed it all, we found that we qualified for the surgery, except for that my placenta was in the exact space where the doctors needed to do the operation. And so there was just no way to do the operation, even though they knew it was going to be a huge benefit to our baby. But the risk was too high with the placenta. And so for several weeks, I just kept going back and back for more ultrasounds, hoping that it would move. And anyway, it was a very painful waiting period. Yeah. And they sent me to Johns Hopkins to get a second opinion. And finally, we were like at the very end of the treatment window. You have to do the surgery before you're 26 weeks, or else the damage will progress too far to where there's no more benefit. So it was 2 days before the end of my treatment window. And I went back in for a last ultrasound. And the tech did the ultrasound on my uterus. There was a tech I hadn't seen before, so I'm not sure if she was like familiar with my previous records.
Yeah.
But she just did it. She didn't say anything. And then she said, okay, I'm going to go show the images to the doctor, and left the room. And we were just kind of like,
dying.
This is in God's hands. Like, we have no control, right? You have no control over where your placenta is located.
Yeah.
And then all of a sudden, all 4 of the MFM doctors like burst into the room, and they were kind of like jostling over who was going to have the ultrasound probe. And the doctor had just looked at me, and she was like, this is an entirely different placenta than the one we saw even 2 days ago when we were at Johns Hopkins. And it was just, I just started to cry. Like, I couldn't even speak. So it was a huge miracle. And we had so many people praying for us to be able to have this surgery. So for me, that was just so faith affirming. And then even after my surgery, the first ultrasound that the doctor came back to do, she said the same thing. She said, you need to write down the story of your placenta, because like they had just never seen anything like it. And they asked me, what did you do to move it? I just said, we just had thousands of people praying for us. So just being able to like share that with them, like I wanted to be able to say that out loud, because they knew it was miraculous, and I wanted them to know why.
I love that story. And I think those of us who have worked in healthcare, we see miracles. And we do. And we see it often. And they're things that are unexplainable. And so I love the idea that it doesn't have to be a miracle to the patient if that's not important to them. But if the patient recognizes that that's miraculous, I love being able to walk with patients in that miracle. Because I think it's important to have hope that miracles can happen. And hope is a huge thing in healing for patients. So just being able to walk with patients in those miracles and in those moments of hope is important.
Yeah. And you could tell, like, these doctors, what they do is miraculous anyway. Like, operating on unborn babies in itself, just that exists, that's completely miraculous. So they are a team that's very open to that. And that's been really helpful.
Yeah, it is absolutely miraculous what they did on your baby. It's amazing that they can do that and then put her back in and she can continue to grow. It is miraculous. Well, thank you for sharing your story. I think that going away from here, I love the wording that you said in the beginning, just how did you say it? Asking if faith.
Is faith or spirituality an important part of your health journey?
I love that. That's a phrase I'm going to use. And like you said, it might be no, and that's fine. But if it is, I want to be able to walk with them in that. So thank you. Thank you for sharing. Thank you for all you've done as a nurse, and good luck. I will be praying for you with your upcoming delivery and hoping that all goes well.
Thank you so much. Yes, we've had miracles and we expect to have more.
Thanks for listening. If you enjoyed today's episode, the best way to support what I do is by rating and reviewing the podcast. Your feedback helps me reach more listeners to make an even greater impact. It would also mean the world to me if you would share it with a friend or colleague who you think could benefit from the topics we discuss. Together, we can transform the way we deliver healthcare by transforming the way we connect. Take care.